Hi, I'm Dr. Vikas Gupta, Director Hand to Shoulder Clinic. Today we'll be talking about wrist arthroscopy. Wrist arthroscopy is a minimally invasive surgery of the wrist. Though we do surgeries of other joint, arthroscopic surgeries of other joint in which we pass telescope through one of the portals or small incision 2 to 4 mm, and we do surgery from the another portal which is again 2 to 4 mm incision. Wrist arthroscopy is a highly specialized procedure in which we use 2.4 mm telescope, which is a very thin telescope which goes inside the joint, and we can look into the joint into the monitor through the scope, and we put in another incision which is again around 4 mm through which we pass in our instruments to do the surgery. Surgeries which we commonly do through wrist arthroscopy are ligament repair, fracture fixations, fixation of the scaphoid, and other ligament reconstructions. Therefore, wrist arthroscopy is a diagnostic as well as therapeutic procedure. That means we can diagnose the problem many times which we are not able to diagnose on MRI, and we take care of the problem at the same time, repair the structures which are torn, which are found to be injured, can be done at the same time. This is a procedure which has over the last 1 decade improved a lot because of the instruments, because of the optics, and becoming very popular. So we'll talk about few common procedures we treat through the wrist arthroscopy. One of the commonest procedure is TFCC repair. TFCC is a ligament which keeps us radius and ulnar together. It is a ligament which starts here and gets insert here. So when it is injured, what happens? This joint becomes unstable. Distal radial ulnar joint becomes unstable. So what we do, we go inside the joint, the telescope goes inside, and we repair the ligament without opening the joint. So this is very minimally invasive surgery. Advantages are that we can mobilize the patient very early. There's a very minimal pain after the surgery, and same day patient can go home after the surgery. And if patient is an athlete or player, they can go back to their work as early as possible. Other surgery which we do commonly arthroscopically is fracture reduction and fixation, in which if fracture is involving the joint, a wrist joint, articular surface of distal radius, then we put in a scope and look at the fracture as if we are looking directly, and reduce the fracture accurately so that we get a good movement, good pain-free movement. So this kind of a fixation gives one of the best results compared to other fixation methods. In many situations, when patient has a wrist pain and we are not able to diagnose what is the cause by doing blood tests, MRI, etc., then wrist arthroscopy comes to our rescue. What happens? There's a synovitis or there's an inflammation into the joint. So we put in a scope, minimally invasive, through 2 stab incisions, and take the biopsy. Therefore, this kind of a surgery helps us in diagnosing a problem which was earlier remained undiagnosed because imaging never used to help us anyway. So we take a biopsy, look under the microscope. At microscopic level, we can make a diagnosis. So this has also helped us in improving many of the wrist disorders which we were not able to do it before. Therefore, we have seen wrist arthroscopy is a minimally invasive surgery which helps us in diagnosing difficult problems and helps us in treating difficult things which were not treatable earlier. And one of the advantages, because it is in minimal invasive, pain is less, post-op rehabilitation is much lesser. Therefore, it has improved our results compared to what we were doing many years back without arthroscopy. Thank you.